Welcome everyone to the third and final presentation or session for my part of the presentation. Um, we've been talking about de-escalation. We've been talking about a lot of different things. I just want to send a reminder for the next, or say a reminder for the next session. We will be having a presenter from law enforcement, and he will be talking about your rights, Good Samaritan law, what to expect, what their training is, and what to expect from them. Law enforcement, when they'd like to be called, how to report. And so if you have lots of questions for law enforcement, that'll be great. And then the next two sessions, USAR will be coming and talking about what things they can offer. And we'll get some firsthand accounts of their from persons with SUD and their firsthand accounts of getting help, seeking treatment, what their experience is, the good, the bad, the ugly. And then we'll finish off with the U of U, talking about how they manage their crisis and their safety plan and things that they do. It's really awesome. I'm really excited for what's coming up. So if anybody else has any questions or wants to share an experience or any changes they'd like to share, if not, we'll just go ahead and get going. Okay. So let's start with situational awareness. We've talked about behavior. We've talked about environment awareness. We've talked about personal safety. We've talked about just overall, or just our different kinds of awareness. And that all comes under situational awareness. Situational awareness is the ability to perceive, understand, and effectively respond to the escalation situation. So everything we've talked about now is all under this situational awareness. To achieve our goals of safety, prevention, facilitate a positive outcome, build trust and rapport, offer choices and solutions, and avoid violence. That is our purpose that we've been learning de-escalation for. So all of the components of de-escalation we've talked about so far combine to create situational awareness. There's recognizing and understanding behavior and what is being communicated. This is what we've talked about already. Self-awareness to ensure we are not contributing to the escalation. How to improve and prepare our environments to make them safer in case of an escalation event. What personal safety habits we can do every day to help prevent escalation. Recognizing the severity level of the escalation and what de-escalation strategy to use. We've been discussing that up to communication. De-escalation is a communication technique. I have not gone on to any physical management, and I won't be. So what comes next? We have had our situation where we've done all other things. We've had a successful de-escalation situation. What comes next? And that is the recovery. So it's the period of time from when the escalation crisis is over and the escalated person returns to baseline calm behavior, and also for staff too. That can be a high stress. Sometimes it's high stress for staff and everything. So we need everyone. This is our recovery period as we're coming down from the incident. So how long can it take? It can take up to a few hours, a few minutes, maybe days, depending on what happened and what was involved and who was involved. Recovery will take as long as it takes. Don't try to rush it. Don't try to return or rush this part, because we run the risk of re-escalating. So as soon as it is safe to, try to return to normal activity and structure for everyone. You want to want to do this gradually because you're still at an increased risk of re-escalation. So some precautions to just take is keep using personal safety habits, no overstimulating environment. You want to do this a little bit slowly for the escalated person. Safe environment with limited safe objects. Be careful what vulnerable individuals they will be around. You don't want to just automatically re-escalate them and they're calm now, but we need to integrate that slowly, depending on the level of the escalation, especially. And then just keep feeding out recovery precautions as the normal baseline behavior continues to be presented. So as they continue to de-escalate, everyone around will be getting calmer, better, everything's getting back to more of a normal situation, then you can keep fading out until maybe the recovery only takes a few minutes, and that would be great. And then we can just return back to normal baseline behavior. So during the recovery, after everyone's recovered or escalated person has left, whatever is happening, there needs to be a debriefing. So for staff, the debriefing is to help with prevention and incident minimization for the future after a crisis or de-escalation situation. It's important to review everything that happened. It's important to go over all the processes that happened, all of the situation, how everybody's feeling, and to get just kind of like how is everybody, like a check-in and allow everyone to process, especially for staff that was involved, to help process everything that happened, to help manage any emotions, trauma and reactions. That goes for any other people that were also involved. That might be something staff has to discuss to manage, is other people involved that were not the escalated person, to learn from the situation and make necessary changes if needed. This debriefing often gets skipped in the de-escalation process, and it's really important that it happens. It doesn't need to happen right away, but it needs to happen within 24 to 48 hours usually, for best F, or at least have it scheduled pretty soon, because then people start forgetting things. People start remembering, not remembering some of the important details because you're moving on and helping other and having a lot of other experiences with other people. We want to gather information and data to track patterns and create an individual plan for the escalated person if needed. So this is another part of debriefing, is documentation. You want to gather information data, especially if you're not going to be able to have a debriefing meeting soon or meet together. Make sure that there's a place for everyone to document the data, so that we can see if this is a pattern, if it's the first start, or if this has been happening. We can start getting that data to help us. Maybe we need to create an individual plan for this escalated person for whenever they're going to be there. To increase personal and staff resilience during escalation, crisis, and recovery. If you haven't been able to fully process something and you're just moving from crisis to crisis to crisis, that's going to wear you down. That's going to decrease your resilience. It's going to decrease what you're able to handle. And personally, you'll just feel really worn down, and it kind of sucks the happiness out of you to run from crisis to crisis. So if you're not getting those moments to debrief, to process, and do that, it could not help. It would create the staff to not be able to help more people. So it's really important that the staff have this moment to, even if it's just to write the data down, and that's what helps. So what would make it an effective staff debriefing? We need to discuss what happened. First, we need to go do a timeline. Where did the incident happen? What was going on when the escalation started? We need to know, what was the beginning? Did anybody notice anything? Were signs missed? What triggers and signals were observed that the escalated person exhibited? Was there warnings that they were going to come? Sometimes people will present already escalated at a certain degree, and it just goes from there. But if they weren't at the beginning, if they were calm, or we thought they were calm, we need to talk about that and figure out if we can figure out what happened. And then what level of severity of escalation happened. Sometimes there's, everyone has a different opinion, a different perspective. We need to get all of those. What severity level did you feel this was at? And what level did someone else feel it at? And feel it was at, and discuss that, and discuss, what interventions were used. Typically when you're using intervention, you want to kind of pick a leader and have like one person working with the escalated person, unless they're going to tap out or switch staff that's helping them. So we just need to understand, were too many people trying to help them? Was one person helping, like what happened with severity, and what interventions were used? What went right? What could have gone better? I don't like to say like what was totally wrong because we're all just having experiences. We're just working with what we've done, and we can only do things that we've practiced or know, especially in those high stress moments and escalated moments. We're trying to be self-aware and stay calm and do and do what we've practiced and do what was going to best help the escalated person. And sometimes we can be like, well, I didn't handle that very well. And maybe you can reflect on maybe what was going on. Maybe you have a lot of stuff going on in your life. You just weren't prepared. This is a practice. De-escalation is like a change of way you are and handling things and being different and being more aware. And so maybe we need to practice doing something different. I don't like to say things went wrong. It's just, I feel like every situation is a learning um, chance and a learning opportunity. And so we just need to be able to make sure we're learning what we need to learn from it. Okay, what happened after? Was there a recovery period? How long was the recovery? What was the results? Did it escalate up to having to have law enforcement called? Was it violent, or were you able to intervene soon enough and the escalation was able to come down? Um, what's after is just important as the rest of it. So making sure we're discussing it all the way through and what happened. And then what changes need to be made? What was learned to help prevent future escalation crises? That's really important. Our whole point, the top goal is to have safety. We want everyone safe. We want us to be safe, everyone around us to be safe, any vulnerable other people around. We want the escalated person to end up safe. We don't want them escalating to the point where they're not safe. So we want, and that's our second and third goals are prevention and incident minimization. So what staff changes to plans or procedures need to be made, if any? Sometimes a plan sounds really great or procedure, and then it gets in action and it doesn't work. So if that didn't work, what can we do to make changes or do better to meet that need or what we want to have happen? Does the escalated person need an individual plan to prevent future incidences? That needs to be discussed. Is this person, was this just a one-time thing, or do we need to have a plan? This person has this potential to escalate. How are we going to take care of this in the future? And then make sure to document all changes. Document, document, document. You're going to hear me say this probably a lot today. If you don't document it, it didn't happen. We need to make sure we're documenting not only to be able to show what happened or didn't happen or what needs to happen next, but to keep everybody on the same page. We need to communicate all changes to everyone that needs to know. And part of that is through documentation, and then everyone can see what's been happening, what needs to happen, and what decisions were made, and if they need to add anything. So we're talking about effective staff debriefing and staff. This can also help with other people that were maybe involved. Just talking to them, making sure they're okay, if there's any needs they have. We don't need to discuss the whole situation to them. Sometimes they'll want to try to understand everything that happened, but basically we just need to meet their needs. If there was anyone else around also. So debriefing the escalated individual. Now this is only do this if it will be beneficial. Sometimes it's necessary if it's someone that's continuing to escalate and you need to create a plan. If you want to create an individual plan, you need them involved because you want them buying into what's happening. You want them helping with making the choices and the decisions, and it won't be successful without them helping you and letting you know what is going to be best. The most important thing, if you do this, is it's a discussion, not a lecture. A lot of times getting in there, it's going to be like, you just wouldn't have done this, and this happened like this, and you just can't do that. That's not what we're there for. We're there for the discussion. Just like the staff debriefing, we want to know what happened. We want to know how it happened. We want to know how they felt. So make sure that you're in the mindset, if you're going to debrief the escalated individual, that it's a discussion. This also needs to happen after recovery for the individual and the staff. When they are in fight or flight, that is not the time to learn. That is not the time to discuss. You are just handling the crisis and managing that. That is not the time they're going to learn or try new things. So we need to wait until in recovery when they're able to discuss it, when they are able to learn. If you're going to have this, depending on the dangerous level of this escalated individual, have one or two familiar staff. You don't want to overwhelm them, that they are familiar with, and conduct the debriefing in a private, quiet location. Sometimes, they come in again and we're just right there at a front desk or with other people around. You want to make sure that this happens in a private, quiet location, not in front of others. Ask if they're okay. You're starting the interview with them, starting the discussion. Ask if they're okay. Are they ready to talk about what happened? And let them kind of lead the discussion, because that will help you get the results a lot faster and will help them be part of the process, which will help them not escalate as much next time. If they stop escalating at all, that would be great. Review with them what made them escalate. They really need to try to understand the situation, what happened. So if they're having struggle, you can say, well, is it okay if I give you my perspective? This is what I felt happened. And when this happened, what were you thinking? What were you feeling? Why did this happen? Like, you want to just have a discussion with their permission, saying, can I ask you questions? Can I tell you what happened? If they're struggling, to let you know. Discuss, how did it affect them? How were they feeling? And then, has this happened before? Where they need to show some accountability here. Like, yeah, I tend to overreact and this is what I do. And then they need to know this affected others and how it affected others. Did they recognize that? Did they see that? So all of that is part of having this discussion to create this plan. What could we do instead? And what can we do to keep this from happening in the future? So we want them letting us know, like, what need were you trying to meet, or what was happening here, and what would be better behavior instead? And if they're having struggle, or a lot of times this is the part that they struggle with. Well, I don't know what I can do. Give them some choices. Remember, choices are our most effective tool, and helps empower them, gives them some autonomy, helps them not feel like they're just being dictated to, which you're going to get a lot more compliance with if you are having them have part of the process. And let them know we want this goal to keep happening. We want this to keep from happening in the future. We're worried about you being safe. We're worried about the safety of others. So we want to, keep everybody safe, and please help us do that. So giving them choices, making a plan with them to prevent future incidences. We want them on board. And then another important part of all of it, make sure to praise their cooperation. Thank you so much for talking to us about this. Thank you so much for helping us with this. Thank you for being willing to make a plan so this doesn't happen in the future. Making sure we're praising every part of their cooperation. So after all of this, the data collection and analysis are a really important part of this. To be able to track behavioral events and interventions, there needs to be a system for data collection and documentation. Everyone has a way of they're already documenting. If there's a way to implement documenting this in with that also, that would be great. Or having a separate sheet. I know some places that just have a Google sheet and they just put the information in there. Whatever will work. You just need to have some way that everyone has the ability to track behavioral events and interventions for data collection. All staff needs to be trained so that the data collection is consistent. You don't want one person writing it in a notebook, one person putting it on their phone, another person writing them on stickies and sticking them somewhere. You need it so it's consistent, and they're keeping the same data as everyone else is keeping, like having it laid out what data we need to collect. Have someone assigned to review and analyze the data to identify if there are any trends happening. If there's someone escalating, yes, there's someone, it's kind of like the squeaky wheel. If they're escalating a lot, and they're coming in a lot, they're going to get a lot of attention. But we need to be paying attention to all the rest also. Is there a certain, is there a certain kind of time of day? Are they happening at a particular time of day? Or do a lot of people seem to be escalating? Or on certain days, or just certain individuals that are coming in for specific things? You need those trends could help, and those trends could also help um, change, like if procedures need to change or other changes, sometimes they're just simple things. There was an example of a clinic that they noticed that they were starting to have more escalations around meal times. So they started putting out a couple snacks or offering a snack to anyone that was coming in around that time. Their escalations went down. They stopped having as many escalations, and the escalations weren't getting as severe. So that's just one example. Um, Use the data to help create or improve safety plans. We're going to talk about safety plans in a minute and creating those. Use the analysis to make changes to improve effectiveness, increase prevention, and incident minimization. This is what this is going to do for you. It's going to improve how well your de-escalation is working and how often it's working. It's going to increase prevention and incident minimization. Does anyone have any questions up to this point? I know I've been kind of talking a lot. Any comments or this is kind of just like a lot of information overload for a minute. Okay, we'll keep going. Data collection. So what are the things we want to document? Like I said, I'm going to be saying that a lot. Document or it didn't happen. So the data to collect or organizationally, these are just some ideas. You can collect your own things that you want, but just to help the process, I've put some things down that would help. So how often are escalations happening? That will be something you want to keep track of. Are you having only them on certain days? Some days have more than others? What is the severity of the escalations? Are there sometimes the escalations are just more severe than other times of escalations? What interventions are being utilized and are effective? If there's certain interventions that seem to be like the standard practice or the gold standard, then those should be communicated to everyone. Like this is really seems to be working and really effective. Time, place, and situation that escalated started. It's really important to always pay attention to the antecedent, like why, like because we want to know why and to try to prevent or intervene sooner. So the time, place, and situation that escalation started is always important to document. Even if it's approximate, just knowing where that started or where it was first noticed is important. Data to collect for the escalated individual. The antecedent, what was happening before the escalation, what triggers, signals were observed, time, place, and who was around them. So not only do we want to collect that organizationally for data, but we want to collect it for the escalated individual too. You want to make specific notes just for them also. Behavior, what level of severity was the escalation? What behaviors were observed? What happened during the escalation? And this is important for everyone that was involved because people are going to perceive different things or understand different things. We've talked about behavior. They're communicating a need of some sort, whether it's avoidance, whether they're communicating, like this is what I've always done to always get a need met. We don't know what we need to discuss that and then observe it and document it. And that's part of being self-aware. We need to be able to stay present in the situation and focused on what is happening instead of, letting all the reactions inside of us happen and focusing on that versus what is happening and paying attention so that we can get the data that we need, the information that we need to help this person that's escalating. And then what happened during the escalation? Did they seem to want to, were they, like pacing a lot? Did they shut down? Did they, um, were they reaching for objects right away? Did they escalate really quickly? Did they escalate more slowly? Like these are all really important things that need to be observed and written down about the patient or the person that's escalated. The interventions, what interventions were used, what were tried, what were successful or not successful, and why. We were talking about that last week when we were talking about what interventions to try when. If you're trying one, they may be a little more escalated than you realize. So we need to switch to a different intervention, one that's for a little bit higher escalation. So what was tried, what was used, what was successful, and why not? And then recovery. What happened after? How long did recovery take? Did debriefing happen? These are all things we need to know for future experiences, for future or for the next person. Maybe this person just escalated one time. They come in several more times. There was no escalation. Then they escalate again. We need to have that data that was there because it's going to be really hard to remember, like, oh, yeah, I remember something happened a while ago. Having it documented, great. And I know that's already done to a degree, but when we're trying to de-escalate and specific about escalation, we really need some specific details documented about that. So we've got all our data now. We've got all of our training of what we're going to do, all the things. Now we need to develop a safety plan, and you can call it, whatever you want. I say safety plan because I like to stay focused on the goal. We're trying to keep everybody safe. People call it a contingency plan, crisis management, whatever you want to call it, whatever works. Just remember, our top goal of de-escalation is safety. So what to consider when we're creating a plan? What de-escalation is going to look like for you? What would meet your needs for what your current situation is? What level of severity are you going to handle? Some people like training, like to know if they're going to do physical management or not, or they just like, this is our cutoff. And after that, this is where we go next. So knowing where that cutoff is, so everyone that's communicated, people aren't trying to handle more than you're trained to handle. That there is a clear-cut plan, because as someone that is trying to de-escalate someone, having that clear-cut plan, knowing what your next steps are, knowing what to do, knowing what happens next on our end is going to help me stay de-escalated and help me stay self-aware. So that is really important to have as part of your plan. What interventions you want used. Maybe there's interventions you don't want used, or these are interventions that you want to try, or say like, these are our list of interventions, practice them, learn them, make sure that we're trying to use them. What environment safety measures are you taking? We talked about the environment, looking around your environment and trying to have it as safe as possible, trying to have things like bigger furniture maybe that could be used if someone escalates that much. But if that's not an issue usually for you, then maybe that's not a priority. Making sure your furniture is arranged in a way that won't trap people, that you can move around easily, that you can move quickly if you need to. Just looking around and seeing what environmental safety measures you need to take. Are there things you need to, tools and things that you need to make sure are locked up or behind some sort of locking or non-access way of people, or need to move things out of places, just whatever you can do to make it as safe as possible. Sometimes you can't ever make any place 100% safe. And we talked about that, and someone will use anything as a weapon. What training are you providing? So you want everyone on the same page and doing the same things. So are you using a program? Do you want to find a program to use, or is it something you just want to kind of create? Using what we put out here would help. Just whatever training you're providing, just making sure that everyone's getting the same training. And then, do you want to use physical management or not training? And I say physical management, because I try to use terms that aren't so alarming, but physical management is a form of safety for people. You can get full-on restraint training, or you can get the safety physical management that just tries to keep the person safe and you safe, whether you need to get vulnerable people out of the situation, keep them from hurting themselves, things like that. There are trainings, different levels of physical management training that could fit your needs if you wanted to do that. Do you want to implement some sort of emergency notification system, and how and when to use it? I remember, was it Cody talking about, they have a button they push in one of their rooms, but it lets off really loud sound, which does not aid in de-escalation. So implementing some sort of emergency notification, or if you already have one and it needs to change so it's not escalating. And know your resources. Have a list of how and when to use them. Like I said, this plan, it could be like just a flow chart. It could be Like how I made my staircase, my de-escalation staircase. We started with crisis, we go to calm, and like all your steps in between that you want to know, you can do some sort of visual so people can refer to that quickly and to know what to do and how to do it. And know when you're involving in law enforcement and how you'll be contacting them. Debating that back and forth costs precious minutes. If someone is escalating to the point that you need to involve law enforcement, that needs to go quickly. And you need to get them there quickly for the safety, for your safety, for everyone's safety. So know what you're doing when you're involving law enforcement and how you'll be contacting them. Typically that'll just be 911, but whatever, if you've contacted them and they have a specific way you want to do that so that they can even respond faster, whatever you've worked out with your local law enforcement should be part of your plan. So decide how you're documenting and analyzing your data. Remember, we need to be consistent on that and doing it all the same so that our data can show us what is happening and what we need to do. What will be your reporting protocol? Sometimes things are going to need to be reported, especially if you're involving law enforcement, or if law enforcement wasn't involved and it still needs to be reported. What will be your reporting protocol? We will be having the law enforcement representative next week talking about that and talking about like when you're reporting something, what's the information they need. So we're not breaking that HIPAA or giving information that's not needed. Communicate make sure everyone is on the same page and has access to the plans and protocols. Like I said, have some sort of visual as one of the best ways that's easy accessible for people, especially as you're learning, because pretty much the only time you get to practice this is when it's happening. You can talk about it, you can learn about it, you can go over it and over it and over it and read it and like, oh yeah, I can get into it. But when you're in that moment, you're going to need some sort of prompting or some sort of way of knowing what you need to do so that you can stay calm and stay self-aware. Have a debriefing protocol for staff to help with processing and accountability. Make sure to say, hey, I want on a part of our plan, we need to have the documentation done by this time. And I want to try and have a debriefing scheduled by this time, especially if they're high stress or it's happening often. Just have some sort of protocol so everyone knows what to expect. There are so many ways to create plans. These are just some ideas that I have seen work and work really well. I've helped create a lot of plans, helped create a lot of individual plans. These are just some things. These are like just some really good things that have really helped make plans be successful. If you need to add more things and do other things, great. Do what works for you. But these are just some ideas to know where to start. But the most important step is making one so that everyone is prepared in the moment of crisis. So we're still, any questions, any comments? Anyone want to share about any of their plans they have already and what they really feel works for them? Okay, we'll move on. So part of, I wanted to ask one more thing. De-escalation it really can be unpredictable, risky, and stressful. And add in the element of a person with SUD. Being as prepared as possible to handle whatever happens will make a difference and help with safety for everyone. We do want to try and be prepared no matter what we're going to be handled because we don't know what we're going to handle. We don't know when it's going to happen and how it's going to happen, and we don't know what we're going to be handling. So being prepared as possible to know what our processes and procedures are is going to help us be able to handle and intervene as quickly as possible. The sooner I've said this over and over, the sooner that you can intervene, the more successful the de-escalation will be. So also part of it is know your resources and your rights. It's really important. These are just very few that I'm listing, like we listed in the chat earlier. The RHAU website, Project Echo, it has the past presentations, slides, recordings for things. We also have on there the database that has a lot of resources to help your patients. If they're trying to meet needs, you have a resource here to help them meet some needs. Law enforcement and your rights and protections. They're going to be talking a lot about that next week. We'll be presenting about that. And then in 3 weeks, the U of U will also be talking about some of your rights and protections and how they manage the crisis and manage that. USARA for persons with SUD. In 2 weeks, they will be talking about this. I was talking about that earlier. They will be presenting on this. They will be presenting with persons in long-term recovery that will be giving firsthand accounts on this. And I've heard some of them present and talk about it. It's very impactful to hear from them directly, being like, I'm coming in seeking treatment. It's hard for me to do that because of this. I want to be upfront because of stigma. We've talked about stigma and the great resources to help with changing stigma. And just hearing from their perspective, like, I want to help and I want to not be a problem, but I need help and I'm seeking treatment. And this is what you can do to make it the best for both of us. So I think it's really impactful. I'm really excited to hear from it. Well, that is basically the end of de-escalation. I thought I would go over a review where a lot of people have missed some stuff. If you had some questions, or we could do a quick overview. There is a couple things that I always point out in de-escalation when I'm doing it, all of these trainings, is don't take any of this personally. Typically, even if they are trying to say personal things and trying to say things, I say Q-tip, quit taking it personally. Make sure you're always staying self-aware and about you and your reactions. Don't take it personally. They're trying to invoke a reaction. They want to escalate and they want a reason to escalate. They are going to push anything they can, do whatever it takes to try to meet that need because they are, for some reason, are wanting this escalation. So that was one of my most important things right there is Q-tip. Don't take it personally. And then the other one is respect as a baseline. When I know I come from the generation of where respect, you're told all the time, respect is earned, respect is earned. The problem with that is that's not a, that's not a direction. That's not a thing to like, okay, when do I earn it? How do I earn it? Well, nobody has the answer of that. Respect is a baseline. Even if we're not being treated respectfully, everyone deserves to be treated respectfully. I'm not saying trust them. I'm not saying all the things. I'm just saying treat respectfully. Starting there is the best start to de-escalation because you're not escalating. You're not responding. You're not reacting. You are choosing how you're doing this. And so they can't escalate because of your behavior. So those are my two top really things on de-escalation. Respect is a baseline and don't take what's happening personally. So, any questions from anyone? We're ending really, this is really early. I mean, I could go on and on. We could go on to a little bit more if people have questions, if they want to talk a little bit more about recognizing behaviors or triggers. We can go back to earlier in the presentation. And as always, to prepare for next week, I want you to write down any questions you might have or things we can discuss. I always leave time at the beginning. Yes, Serena.
I have a question, and it's probably just repeating some of the stuff that you already said.
That's fine.
Did you say, did I catch that right? Did you say that if staff doesn't know what the rules and the regulations are, the policy is, regarding de-escalation, it causes a lot of chaos in the work environment? Did I hear that correctly?
Just when you're creating a plan, that was the point about creating the plan. Just sometimes when there's not a plan and everybody's not on the same page, then you got a lot of people like, well, let's do this, we'll do this, let's do this as the person's escalating. And so that was just like, we're trying to escalate and intervene as fast as or de-escalate as fast as possible. That's not the time to be like discussing what are we going to do, how are we going to do it. Sometimes that does have to happen because maybe you don't have anything planned for what's going down because who knows, I say I think I've seen everything and then I get surprised. So
Thank you. Thank you.
just trying to prepare for that the most is what's going to help. It's going to help everyone stay calmer and help the person that's escalating get helped faster, if that makes sense.
Yes.
So maybe I said that too fast. Does that sound right? How we said it?
I was like in and out of the next room, so I thought I misheard or something, so thank you.
Mhm. And also with that, typically picking someone that is going to be kind of a leader if there's an escalation happening, someone that kind of takes lead on it, because you don't want like 5 million people trying to talk to them all at the same time. That's not going to help with the de-escalation. Someone kind of taking lead with that is always really helpful with the plan also. So any other questions? That was a great question, Sabrina. Thank you. And great for to clarify. If there's anything I need to clarify. To me, I do this a lot. I've done this a lot. Um, it kind of seems just kind of routine a little bit to me. So if there's things you want to discuss or I didn't discuss well enough, please let me know. Looks like we're pretty good. I guess we're ending very early today. Hope everyone's okay with that. Um, just as a reminder, next week, we are going the next consecutive 3 weeks. So the next week will be law enforcement here. I'm really excited about it. We've been working on their presentation and I'm excited about it. I'm learning lots of new things. The next week is USARA. So in 2 weeks is USARA and the first person accounts. I'm excited to hear about that and hear about the resources they provide that will help anyone working with persons with SUD. And then the last will end up with hearing from the U of U. They have a great presentation on de-escalation and managing crisis and resources that I'm excited. I have gone over that with them also, and their presentation is really wonderful. So thank you, everyone. I'll stay on just a couple more minutes if there's anyone who wants to talk about anything, but thanks. And we'll see you next week.